her son was born healthy. But talk about the serious risk of having this kind of disorder while you're pregnant.
Yeah, well, first of all, Robin, most women with eating disorders have a difficult time getting pregnant in the first place. And when they do, there are risks. First of all, women who restrict calories, they not only malnourish themselves, but their children. The fetus could be undernourished, obviously, underweight, and be born premature. Furthermore, women who purge, who use laxatives and diuretics, have problems with electrolyte imbalance that can ultimately lead even to cardiac arrhythmias. And then there are, following the pregnancy, concerns. The risk of postpartum depression is very high in these women, even if they have no symptoms during pregnancy. And then finally, they have more difficulty breastfeeding.
How much weight should you gain when you're pregnant?
Well, the average weight for a normal, healthy woman who begins with a normal weight is about 25 to 35 pounds. That translates somewhere into about a pound every month for the first trimester, and then a pound every week thereafter. This is a daunting task for a woman who has lived her life worrying about gaining weight.
And you said it's very difficult for these women to become pregnant, but what is usually the response when they do become pregnant?
Well, actually, there is good news in this story. Women, it seems, studies have shown about 75% of women who have an eating disorder when they get pregnant will actually get better during the pregnancy. They will gain weight. They will have a healthy outcome, a healthy baby. But what happens, about 50% of those women, right after pregnancy, they then go back to their same ways, their same eating habits. It's a very tough disease to fight. But again, the good news is for women who do get pregnant, there is certainly hope, and they need a lot of help.
Yeah, but 50% normally go back to having the disorder. We saw Beth's husband, Mike, just breaking down, and how difficult it is on the entire family. If you have a loved one who is going through this and is pregnant, what advice do you have for them?
Well, first of all, remember the woman herself is feeling so much shame, and she's often silenced. I mean, she does a lot of her behavior in silence. So we need to remember teamwork really matters. I think a woman should identify a health buddy. In this case, it could be Mike, or it could be your girlfriend, perhaps a mother or a partner, someone that really helps keep you vigilant, goes to the doctor's appointments, helps you get weighed, really keeps you on track. Second of all, I think it's important to get your OB, your obstetrician, involved as soon as possible. You've got to talk about your eating habits. Doctors can really help out and make sure that you get the care that you need. And then third, you need to work with a nutritionist. Before pregnancy, ideally, get your weight up as close to normal as possible, somebody who's experienced in eating disorders. And then finally, you just really need to make sure you're in therapy, maybe group therapy, but therapy.
All right, Marie, thank you. You can learn all the details about Beth's story by watching I'm Pregnant. We'll be back.